I don't really have a lot of updates from last week. It's no new updates on Stratus, which is I talked a little bit about this last time. That's one of the new variants that seems to be a little bit more virulent, but doesn't seem to be a bit more severe. So it's kind of I don't think that that's going to change anything. There are some statistics that it's crossed double digits now in large parts of the country. So I'm guessing it's going to overcome the nimbus pretty soon. Sounds like it's growing much faster than the other one. So those just quick updates on strains. Again, I don't have any updates on the vaccines. You're all probably following political drama of the fact that all mRNA research was shut down. Whether that's gonna come back or how is it gonna translate to COVID, I don't know. Frankly, I'm kind of getting to the point of saturations with all the drama. So I don't know about you, but I think I need to sort of like not follow some of this stuff because it's really unclear what will actually come out of any of this, right? So that's all I have on that. I don't have any other updates except to say that I'm quite excited because I found a whole box of unexpired tests in the house. Apparently, we had a box of medical supplies from the move last year that didn't get opened up, and somehow those tests they're going to expire in a couple of months, but they're still probably useful. But anyway, everybody should have kids at home. COVID is around. If you don't have it, that's fine. You can always get it from any local pharmacy, but be prepared to pay a little bit, somewhere between $15 to $20 a kit, roughly. Sometimes you can get them cheaper if you buy a bulk, like if you buy two or more. Sometimes you probably can get it down to about $10. So I have a topic, but let's see how far we're gonna get with Q&A as usual. Because I don't really have anything else on COVID, so I rather we spend a bit more time with questions so you guys know the drill. We are having this new system where unfortunately you cannot unmute yourself unless we unmute you. So if you want to speak up, just raise your hand like that on the React. There should be uh, how do we do this again? I thought it was on the React somewhere. That you can raise the hand. Yeah, so it's on the React, there's this button, raise hand. I just did that. So if you need to answer, otherwise just put your questions in the chat. Okay, anyone know if there are any places that are giving COVID tests for free? Now, I'm not aware of this. So if somebody would like to take on themselves to research this, I would love that. The last I checked that were free website, they stopped giving it. But maybe there's some other sources. I've heard sometimes that there's some excessive tests that were sitting around the libraries, but I think that kind of ended quite a while ago, more than a year ago. So I don't know if any libraries are still having that. Okay, so this variant system, not that I heard of the Stratus. I haven't seen that particularly described. They saying that it's there's not a lot of new symptoms for this one. It's kind of similar to the prior ones. It does not have the razor throat. That's the Nibus. Stratus does not have that. So I haven't heard that it has more muscle or nerve pain. But again, this is relatively new, right? So we'll have to wait and see whether some of the symptoms are going to be more prevalent than others. And in our area, apparently Stratus is in the single digits yet. It's in double digits, kind of a more of a West Coast and mid-country. East Coast still has mostly Nimbus. So, all right, any other questions? Doesn't have to be COVID questions, by the way. Remember, we are now kind of broadening. So if you have anything else you want to bring up, then by all means. Otherwise, I'm happy to talk about. Today, I was going to talk a little bit about integrative tools for pain. Okay, have you read this study? Let's see, what is this? Oh, makes a lot of sense. I have not seen this. So, study confirms post-pandemic rise in disorders of gut-brain interaction. Well, I want to say duh. It makes perfect sense, right? We know that inflammatory response quite often centered in the gut. We have an outmost expert in the room. Maybe at some point, Dr. Frame want to unmute and contribute to this discussion. But I totally makes perfect sense. And also I wonder if some of the future treatments should really be centered on treating more of the, it's interesting. Let me just reflect on one thing. I definitely have see a tremendous increase in IBS in applications to the clinic, a lot more than before. So maybe that is related to this. Maybe it's just that sometimes we have fluctuations in some conditions that are coming through. Sometimes we do a little bit of advertising, but I don't think we did any advertising for any GI problems in quite a long time. So, but there's definitely been a higher bump in that. Interesting. Please talk about poison ivy. Why would I talk about poison ivy? What do you want me to tell about poison ivy? Don't walk into it. I mean, if you do, good luck. My personal best topic is just use topical cannabinoids. I hate topical steroids. I personally respond very little, but one of my kids has a severe reaction. I don't know what else to say, really. It's not fun. Why you got it? Is that yeah? Oh well. Yeah, so topical treatments only if it's really horrible short course of steroids, not a big fan of that, but sometimes you have to, especially if you have to get this kind of over with ASAP. Let's say you're traveling or something. Nothing wrong with 5 days of 40 milligrams of prednisone. Again, not a big fan, but if you have to, you have to. Otherwise, topical, you can do a topical steroids, you can just do like a topical Benadryl just for symptoms. You probably know that. Oh, let's unmute you. Okay, there we go. Jennifer, you should be able to, yeah.
Okay. So I have it. It's dermatologist thinks it's systemic. It keeps on spreading and I'm not exposed. I'm extremely sensitive anyway, but I just wondered, and she put me on prednisone.
Good.
Um,
That's the right thing to do, actually, because if you're hypersensitive to poison ivy and you start getting a much larger area rather than what was exposed, you have to do systemic. You definitely want to do all the typical things. You want to do some turmeric, you want to do quercetin bromelain, you can do the dehisce in very high doses, like 2 capsules every couple hours. But really, you just have to push forward.
she's pushing the topical steroids too, but
Well, topical, if the large area is exposed, I wouldn't do. I would just take it orally because, like, what's the point?
well, both, both.
Yeah, yeah. I mean, you do what you have to do. Usually, it's short-lived.
It's it's
Um,
been pretty awful.
how long it's been now?
Started a week ago, but it's keeping on spreading. I get new patches virtually every day, and I've done everything. I've washed everything. I've changed bags. I've done
Take a very high dose SPM.
a very high dose.
SPM. It's a product called Resolvins, and you can do. I think it's called the Designs for Health has a good product, and also Metagenics. Metagenics, I think it's called SPM Active. I don't remember what's it called with Designs for Health. Just shoot me an email. I'll order it for you.
Okay, thanks.
Yeah, because sometimes what happens is you get it's not that the toxin is still there that's causing reaction. You simply kind of triggered out.
Yeah, that's what the dermatologist said.
Yeah, and you have to shut it down as soon as possible. Believe it or not, steroids don't shut down inflammatory response, they lower it. So the SPM is actually a really good product because it really, really resolves the inflammation. So it's something that everybody should be
And
aware
it's
of.
not contraindicated with the prednisone.
No, no, not at all. Completely different.
I got a knee injury that prednisone's helping too. So
Okay, please don't get used to it. No,
no,
steroids,
no. I
when
do not plan to.
especially when you never had steroids, sometimes they literally feel like miracle drug. You take it and everything's better.
I've had them once before, and I know it is a miracle, but not without its very big downsides.
All right.
Thanks.
Sure. Okay, I love it. We have finally a lot of questions, so I feel better because I don't know if I want to. I was recording a talk for a conference in Wisconsin on the chronic pain, but I think I had my um, share of presentations for today. I much rather answer your questions. Okay, so question from last week regarding NAC. Okay, is NAC antimucolytic? Absolutely. Yes. Short answer is absolutely yes. And actually, it's quite drying too. So if you take enough of it, it's not just going to be mucolytic, it's also going to be quite drying. You have to be a little bit careful with that. If you tend to be prone to have a lot of dry mouth or kind of dryness symptoms, I probably would start with a bit lower dose because sometimes people get it quite really dry and it's unpleasant. Of course, you can drink more water and you can be more attentive to dryness, but you know, if especially if you need to take neck for a while, like if you need to take neck for a couple of weeks, it can be quite uncomfortable. So start with 600 in that case. Otherwise, if you don't have that, then take 900 twice a day. We were talking about NAC, everybody, in the context of acute COVID. It's a really good tool. It's a very cheap tool. It's much cheaper than glutathione. And in some way, it's actually maybe even more indicated than glutathione. NAC has somewhat of a broader action. Glutathione is much more potent as a detox molecule, but during the COVID, I think NAC may actually be more important, particularly because it's mucolytic and drying. So that, you know, there's a lot of secretions that you want to clear out. Okay, so next question. Do you think the GBD, Guillain-Barré disease, is a real risk for various mRNA vaccines? Well, yeah, so Guillain-Barré is risk from all vaccines. There's almost inevitable uptick in Guillain-Barré, regardless of what vaccine it is. Generally, it's considered to be a very small increase. However, I'd say it's not trivial, so it is real. It's very small, but it's real. So if you concern about that, then you know you could maybe research this a little bit more. The good news, most of these cases are that happen post-vaccine are relatively mild and fully self-resolving within a couple of months. But GBS can be quite severe. GBS can also, believe it or not, happen right after any infection, particularly any viral infection. So, and it happens quite a bit after COVID as a part of the COVID syndrome, acute COVID. So you do need to be aware of that as well. So it's not just the vaccine. It's unfortunately, it's actually very, in severe form, it's a debilitating condition. It's basically ascending paralysis that starts with the feet or legs and then kind of goes upwards. And it can paralyze most of the body for quite some time. So it actually could be quite devastating of a symptom. Fortunately, that happens extremely rare. Most of the cases of Guillain-Barré are quite limited, self-resolving, and people don't get to a severe situation. Okay, Salome has a hand, so I'm gonna get you to unmute yourself. Go ahead, unmute yourself and ask your question, and I'll go back to that.
Oh, it's because you mentioned glutha something.
Mm-hmm.
Glutathione? Okay,
Glutathione.
because last week, yeah, I have some left over from previous COVID. Can I still take it?
Probably not. Check glutathione is critical not to take in expired form because it's an antioxidant, it gets oxidized, and then you don't want to take it. So you need to check the expiration date. This is one of few products which absolutely should follow expiration date. If it's expired, please go get rid of it.
Okay. Thank you.
Yeah, you definitely, you never want to, this is really important concept. If you're taking any antioxidants for any reason or any detoxifying molecules, please make sure, especially with antioxidants, that I'm going to mute. Salome, I'm going to mute you because we're getting a little bit of a... oh, I'm sorry, I muted you. Go ahead, finish your...
The NACA is also from previous time.
NAC is going to be fine. NAC has a much longer shelf life. So NAC is okay. NAC is very stable. NAC usually comes, it can come in capsule, it can come in tablets. If it's in capsules, it's in powder, but it's much more stable molecule. That's also another reason why I like it more. It doesn't matter what form you're getting. It's more stable, it's easier to get, it's cheaper. Glutathione has to be very high quality, always liposomal, always in special preparations, can tend to be very expensive sometimes, especially if you're taking a high doses. So that's one of the main reasons. But NAC is fine. For COVID, NAC should be fine.
Thank you.
Sure. All right, let's go back to Carice is asking, do you think increased stress over the past few years also contribute? Well, of course it does. I mean, you know, we know that that's unfortunately a huge factor. In fact, we know that stress impacts gut health in a variety of ways. One really unfortunate way, whenever you're stressed, your peristalsis, your movement of your gut changes. It slows down, and it's not just slows down so you get more constipation. Of course, you can treat that. The bigger problem is that when the bowels slow down, microbiome rapidly changes because microbes, just like our health, there has to be a normal movement of the bowels for the microbiomes to sort of be okay. It's actually one of the critical reasons why everybody should have a normal bowel movement. And the fact that I really dislike some of the, okay, we're getting recorded. Maybe I should shut up. But anyway, the point being is, gastroenterologists tend to say, oh, it's fine to have a bowel movement every 3 days. No, it's not fine. For optimal health, you really have to have bowel movements once or twice a day. That would be the optimal, particularly because we know it's associated with a better microbiome. So, great questions today. You guys, despite being in August, we're rocking here. I love it. Lenier treatment for tinnitus. Okay. You guys putting me on the spot. I have no idea, Rona, what that is. I don't think I've ever heard of it. So do you want, if you have a link, throw it in. I'll see if I can take a look. Unfortunately, I don't know, so I can't say. Sounds expensive. Yeah, the tinnitus is a very difficult condition to treat, especially when it's severe. In fact, it could be really like a severe reason for depression and suicidality. I've seen some patients with a horrendous tinnitus that were talking about taking their lives because they couldn't really move forward and nothing was helping. So it's not surprising to me that they're really expensive treatments. I don't know if they work, but if they do. Okay. With all the talk about microplastic concern, Invisalign is a risky. Oh, you guys, great questions today. So believe it or not, yes. In fact, I even talked to Ali Cohen, who we did her podcast. I don't know if Janet has a second, but maybe she can find the podcast with her that we recently put out, her new book called Detoxify. She's quite vocal about all of these things. She's vocal about that. She's even vocal about flosses. She's quite aggressive that we are to use natural flosses, that we don't use those plastic flosses. Everything you use inside the body or near the body that will go in, I would try to minimize it. Now, having said that, I sometimes use regular floss. So because I'm lazy and whatever, laying around, I will use, and my wife sometimes buys whatever. So yeah. All right. Yes. So thanks for Stephanie to put SPM active. But Jennifer, SPM active is quite expensive. So send me a message so I don't forget, and then I'll order it for you with the discount. So it's easier for you to get it from FullScript. It is fish derived, correct, but you cannot get enough SPM from fish. It's a very concentrated. So Dennis, unfortunately, no, you cannot even eat enough fish to get enough SPM. So you will have to take massive doses, probably going to be unrealistic. Thank you, thank you. So those of you who are interested in the Detoxify podcast, take a look at that link that Janet just posted. Okay. Yale study showing microbiome changes from other drugs. Yes, there is again, Dr. Train probably be a lot more thorough than me on this, but there is a whole host of drugs. And what's really shocking, sometimes they have nothing to do with direct impact. Like, for example, some of the really bad products, like for all the old antacids, even the Pepsid to some degree, to a much lesser degree, but PPIs, all PPIs are awful for microbiome. And so that makes sense, right? You change the acidity of the stomach, of course, you're going to trigger, changes in pH throughout the gut as a result. And then all the microbes have very specific niches, right? So they like particular environment. You change that environment, you're changing those species. But then there's you correctly pointing out things like benzodiazepines change microbiome. That we think is due at least in part to the movement of the gut to peristalsis. Opioids will definitely, or most of the pain pills will have some negative impact. Unfortunately, most of medications have negative impact, not positive. Yeah, right. So that's also a problem. So many foods that are healthy foods, the fiber, lots of certain things, fermented food. I mean, certain foods would be really good for microbiome. Unfortunately, most of medications are the reverse. I'm sure there is a website or some kind of a very specific, concrete way to look this up. I'm sure this was done. So, all right, so let me click on that linear link, see if I can figure something out right away, but interesting. So some kind of a headset with something sticking out of your mouth. Okay. Huh. Interesting. Rona, I don't think I'll be able to analyze this quickly. It's probably going to need, 15, 30 minutes of my time. I don't know if I'm going to commit to this. See if I have time. I've been quite busy, so. All right, well, we're at 2:25. I don't think I have time to talk about my topic. Okay, a couple more questions, so we still have a couple minutes. Can one substitute for no, you cannot. So the SPMs are quite specific molecules. The fish oil capsules have tiny amount of it that is not clinically relevant. Now, but it's on the reverse. SPM has enough EPA and DHA, especially if you're taking more than, let's say, 2 capsules. If you have 3 or 4 capsules a day, you're probably going to get enough omega-3s in SPMs. The problem is it's way more expensive. So SPM is it's one of the most expensive supplements on the regular market. I mean, of course, there's a lot more, even more expensive supplements. But if you take 4 a day, you're looking at probably $150 a month, maybe more. So it's not cheap. Most of people will not need that much. Most people from the standard dosing will only need 2 capsules a day for a few months, maybe 2 or 3 months. It's not a prolonged treatment. SPM's typically given for, I would say, 8 to 20 weeks, somewhere in that range. I do have some people on the long-term SPM, but that's quite specific, and I don't want to really discuss this today because it has to do more with what triggering inflammation. So if we have a patient with some kind of a chronic toxicity, like mold toxicity, for example, so sometimes we'd give them SPM for a lot longer, but that has to do with an individual response. So not necessarily with a specific condition even. No, so NAC will not thin the mucosal lining. NAC will drop, it's mucolytic. So mucolytic literally means you have less excretions. So you have less, mucolytic means busting or lysing of the thick mucus, right? That's what the term means. So you can hack it up or you can cough it out or however it comes out. But no, it's not going to really thin the mucus lining, I think. It's perfectly fine. It is not a blood thinner at all, not even remotely. It's completely fine to combine with any blood thinners. There's very little contraindications for NAC. The only relative contraindication is a diagnosis of cancer. So patients who have cancer have to be a bit careful. NAC seems to be quite protective for cancer cells. So especially people undergoing cancer treatments with chemo or radiation should absolutely not take NAC. There's been good data on that. But let's say you've been treated for cancer, now you're cancer-free, or you have maybe some controlled cancer on biologic agent, for example. I probably wouldn't worry about a few weeks of NAC or a few months. You're not talking about taking NAC forever. If you're taking it for acute symptoms for a few weeks, you're going to be fine. I wouldn't worry about that. Yeah, but there's statistics. There's clear contraindication in case of acute cancer treatment. So that you have to be very careful with that. All right, 2 more minutes and then I'll hand it over to Michelle. Michelle, thanks so much for being here. You've been such a trooper coming back to us. I don't know why you like us, but we love it. Thank you.
No problem.
All right, so I don't see any more questions, so we'll give you an extra minute. And yeah, thank you. Let me add spotlight. Okay, there we go.
Can you hear me okay?
Yeah, perfect.
Excellent. Well, you mentioned a few things that got me excited about the meditation I wanted to bring today. You specifically used some words like chaos, a lot of the noise that's happening around So I've been thinking about that leading up to today, just the chaos that we're all experiencing. So I wanted to offer an eye of the storm meditation. And it can be particularly helpful because it focuses on the breath. There's a bit of imagery and lots of body awareness. So I'd like to start with that and offer that. So it's called, like I said, Eye of the Storm meditation. And we're going to just practice the next few minutes finding calm in the midst of chaos and stress and strong emotions, especially as we enter the weekend. And we're going to use our breath to just center ourselves and to create a quiet space where we can rest and reset when life storms are swirling all around us. So I ask that we just start by all of us finding a comfortable position, perhaps sitting upright, and I'm going to do it as well. In a straight posture, if you feel better laying down, you can do that with your arms resting to your side. Feet, if you're sitting firmly on the ground. And I'm going to invite you all to just gently close your eyes. And let's turn our attention to the breath. And we're going to start by breathing in through our nose and out through our mouth. And with each exhale, see if you can soften your face and relax your jaw, dropping your shoulders. Just kind of let your bottom just sink into your chair. We're just going to keep breathing for a few breaths in and out. And as you breathe, notice where you start to feel the sensations, whether it's in your nostrils or your throat, or perhaps in your chest or your belly. And wherever you feel it most strongly, start to focus your attention there. Breathing in and breathing out. If you're noticing negativity or fears or worries starting to creep up, gently bring your attention back to your breath, resting your awareness there, letting it anchor you to the present moment. Again, continuing to breathe in and out. And just keep breathing, focusing on how it feels, letting it connect you to a place deep within yourself that's quiet and peaceful. And start to imagine a vast storm swirling all around you. Winds, rain, waves, or whatever image comes to your mind. And this storm is representing or may represent the noise, stress, the demands of life, the chaos of the noise. It may help you to visualize any upsetting thoughts and feelings as the storm circling and whirling around you. And these winds may be strong, the rain fierce, but in the center of the storm is a place that is calm and still. And this is a place of rest within the turbulence that surrounds you. And you can access it anytime using your breath. The air around you in the center is calm. The light is gentle. You are untouched by the chaos outside of this circle of stillness. And as you're breathing, be aware of whatever thoughts, feelings, or sensations arise. Not reacting or judging, simply observing. Noticing how the storm is constantly moving and changing all around you. Yet here we are, here you are in the eye, which is peaceful. Breathing in and breathing out. And no matter how intense the storm gets, you're safe here in the eye. Resting within the breath and within the present moment. As you breathe, there might be times when your mind wanders and begins to get swept away by a strong thought or emotion. And when that happens, don't worry. Without fighting it, let it return to the storm. Then bring your attention back to this breath and back to the calm, quiet eye within yourself. Breathing in and breathing out, moment by moment. And keeping in mind, there may be times when you get caught up into the storm, but when that happens, you can always come back to the breath, grounding yourself in the present moment and resting in it. Keeping in mind that even the fiercest storms are temporary. This too will pass. Now, take a moment for a few more deep breaths in and out. When you're ready, and only when you're good and ready, open your eyes and come back to your space. You can start to wiggle your hands and wiggle your toes. Start to stretch your body. And welcoming the new calm. And I'd just like to thank you all for being here and doing this breath work with me. And I hope it's something you can tap in over the next few days.
Thank you, Michelle. This was wonderful. We're a little bit early, so I think it's fine. I think that's fine. So if anybody have any questions for you, Janet posted what we have next week. So we will be, oh, Shervan, wonderful. All right, you guys. I think she was with us once, I believe. So we'll be talking about what Shervan will be talking about. I'm sure it'll be some mind body, and we'll talk more. So yeah. If you have more questions, I'm going to stick around. As I mentioned in the chat, if you have something personal to me, definitely stay. Otherwise, we will finish a little bit early today. I think nothing wrong with that. Go enjoy.